fellow warriors, survivors, and conquerors. My name is Shalawn James, and I'm the Acting Executive Director of the Mental Health Association in Pennsylvania. And it is my hope that this message finds you in great physical and mental health. I come today as not only an advocate for mental health awareness, but also as a survivor and conqueror of my own traumatic past, and as an advocate for my teenage son. I come today as a member of the African American and LGBTQI communities, which brings additional barriers to be conquered. But more important than all of who I am, I come as a beacon of hope, compassion, and resilience, reassuring you that no matter where you are in this journey, tomorrow will come, the sun will shine again, and there is hope even when all around us seems hopeless. I want to take a few minutes of your time today to talk about and shed some awareness on mental health and its impact on marginalized communities. When we talk about marginalized communities, we are talking about those communities that tend to have limited access to services, treatment, and resources. Oftentimes, these communities are forgotten, not purposely, but in our efforts to fight for equality amongst those with mental health, we often forget these groups of people. Statistics have shown that individuals of the African American, Native American, Latino American, and of the LGBTQI communities are often underserved when seeking, accessing, funding, and maintaining quality mental health services. Barriers most often noted are increased stigma, language and cultural differences, and a lack of quality insurance and financial resources. Fortunately, all hope is not lost. We can, as a collective, make the efforts needed to ensure that all individuals have access to the care they need. David Satcher, former Surgeon General, provided us with a comprehensive outline of how we can tackle the issues of inequality for not only marginalized communities, but for all along their mental health journey. Number one, our work should be based on the best available science so that we may prevent disease and promote good mental health and physical health. Thus, we can continue to enhance mental health research, especially prevention and promotion. Number two, we must acknowledge and find ways to overcome barriers of stigma. Number three, we need to build public awareness regarding mental health and effective treatments. Number four, we must address the serious shortage of mental health providers and the lacking of training available for our community helpers who are potentially impacted on a person's day-to-day. Number five, we need to ensure the delivery of state-of-the-art treatment, which means moving frontline knowledge to our frontline care so that primary care providers have access to knowledge, technology, and teams of experts to support their work with their patients and families. Number six, we need to tailor treatment to age, gender, race, and culture. Number seven, we need to facilitate entry into treatment. And lastly, number eight, we need to remove the financial barriers that create complexity and restrictions within our healthcare system. While we have made great strides in these areas, there is still work that can be done. Governor Wolf, in his Reach Out PA, Your Mental Health Matters campaign, has outlined methods to help us as a state address many of the action steps mentioned above. MHAPA, along with its affiliates, applaud these efforts. I encourage you to do your part in lessening the gap by ensuring quality mental health for all. United we stand, divided we fall.